Tate Chronicles now transmitting.
Welcome to the Tate Chronicles on Healthcare Now Radio. And now, here's your host, Jim Tate.
Good day, citizens of the free world, from border to border, coast to coast, and to all the ships at sea. I bring you a warm welcome. This is your correspondent, Jim Tate, and thank you for tuning in to the Tate Chronicles. Join me as we cut through the fog that exists at the leading edge of healthcare delivery and technology. I'm really pleased today. Sitting in the guest seat is none other than Robb Hutchison. Robb is the CEO of Proficient Health. Proficient is a well-known leader in improving referral management and secure communications for medical communities. Robb, welcome to the Tate Chronicles.
Good morning, Jim. Thank you for having me.
Robb, I know one of the greatest challenges in the delivery of healthcare is the ability for providers to exchange medical information. This is particularly true in the case of hospital systems that need to communicate with their physicians and other post-acute provider networks. I'm looking forward to hearing your thoughts on how these challenges might be addressed. But first, let me ask you, Robb, you have both a clinical and technical background. Can you tell us a little bit about how that combination led to the formation of Proficient Health?
Absolutely. I think two things, Jim. Really my unique career opportunities that I was very fortunate to experience early in my career due to having a clinical background, working in the home care industry, working in the long-term care industry, and working with specialty hospitals. I found that by working across the continuum of care, I saw that breakdown and the impact that it had, the breakdown in communication, referring patients from one organization to another, the need for those services to be delivered by specialized physicians in those communities. Due to my career, and then having had multiple startups since 1999, really enabled me to tee up the not only the technology for Proficient, but the team. And we just have an incredible team that's committed to our mission and our vision to improve communication across the healthcare continuum.
I know one of the things your company focuses on is improving provider-to-provider communication. How does that differ from what existing EHR systems can already do now for providers?
Jim, that's a really complex question, but I like to start off by saying that we do that by trying to keep things very simple. Okay. We really truly market our solutions as EHR companion technology. So that what we're doing is we're really enhancing the tremendous investment financially and in time that hospitals, health systems, physician practices, and other healthcare organizations have made in technology today. So we're what many people call EHR agnostic. So that from a computing perspective, we're really working with all platforms and all operating systems. Today, when you might find a hospital that has a system-wide a system-wide solution to manage their patients' information, much of the information that they need is found out in the provider community. So just like you mentioned, starting your question, bringing that information into the point of care and then ultimately into the revenue cycle presents multiple challenges when you have providers spread around your community and sometimes even outside of your community that are delivering care to your patients.
Well, let me ask you about a specific scenario. Let's say I'm a specialist and a patient has been referred to me and they have shown up for their appointment, and maybe I've got a little information that's been sent to me about that patient, but maybe I want to communicate with their internist or their, whoever referred them. How would the communication take place in a scenario like that?
Well, this is really the genesis of why Proficient exists today, Jim. In many communities, people are still using very antiquated workflow processes that involve phones, pagers, fax machines, and fax servers, all which are very inefficient, lack accountability between people. So by putting standardized workflows in place and standardized work processes in place to refer patients and get the information again at the point of care, or have the information at the point of care when a patient presents, when their caregivers and other family members have brought them to receive care, and ultimately for the revenue cycle to work for these health systems, that information has to be available to avoid write-offs and avoid delays in care delivery. So specifically to answer your question, by being able to streamline those processes using mobile solutions and other desktop solutions to standardize those workflows, we allow specialists to communicate with other specialists right away and be able to communicate with the right physician at the right time. Without going into a lot of details of how we do that, through intelligent message routing and things like that incorporate call schedules and those things, we're really reducing the length of stay that the patient stays in the hospital and reducing the time to the consults, both inpatient and outpatient, so that there's more effective care delivery. Patients are seeking and receiving care in the right place at the right time, and really just streamlining that whole workflow. So again, back to the simplicity of really leveraging technology today, like most everyone's doing in our personal lives.
Robb, I live in Chapel Hill, North Carolina, and so the healthcare network I'm in includes a hospital and providers and specialists, and so they have everybody's using the same EHR. It is pretty much as close as you can get to interoperability. However, the UNC network, and then 20 miles away is the Duke network. And so there often seems to be a giant gap between the two, how information can flow from one side to another. And I know over the years there's been an attempt, first with regional health information organizations, RIOs, and then health information exchanges, those HIEs, and then going forward, TEFCA, some way to bring at least interoperability to the data. But it sounds like the work you're involved with is not necessarily just the data, it includes communication. That includes data but goes beyond data. Do I have that right?
Oh, absolutely, Jim. You're getting right to the heart of why we exist. As you know, I'm in North Carolina. I also spent 4 years in Chapel Hill, right there where you are. So I'm familiar with the system, and I'm familiar with the other systems around the UNC system. If you'll think about this for a few minutes, there's not only the glorious Carolina Blue system there with UNC, there are many other systems around UNC, and fortunately UNC providing world-class care there with specialists and subspecialists are also delivering care to other community hospitals and other healthcare organizations. Mm-hmm. So while the system that is in place at UNC and is available to many of their physicians, there are communications that go on every day and 365 days a year with other physicians in and around the triangle of North Carolina and even outside of the triangle. And when you bring the other system down the road there, Duke, into the equation, they have an even greater outreach into, I think the last time we spoke with them, they're providing consistent services in at least 35 counties in North Carolina and even outside of North Carolina. So you can imagine that regardless of having one system in place, there are hundreds of other systems, EHRs and EMRs and other systems in place. So achieving that single patient record is ultimately or virtually impossible. So by providing that solution that enables you to talk to the right provider at the right time, reducing the time to consults, and then ultimately reducing the patient's length of stay in the hospital, really improves the care delivery model and reimbursement.
Rob, as far as Proficient, who are your customers? Are they large hospital systems? Are they individual practices? Who do you service and support?
Yeah, that's a great question, Jim. We work with anyone from a critical access hospital with 25 beds all the way up to large 1,000+ bed academic centers, and kind of everyone in between. From a hospital perspective, we work with for-profit chains of hospitals down to 200-bed community hospitals. So hospitals are really that hub of communication in a community. Mm-hmm. And so there may be in one community like Charlotte, North Carolina, or Columbia, South Carolina, or Atlanta, Georgia, there can be multiple hospitals. Some of those providers can be working with multiple physicians, primary care physicians, and other specialists in and around those communities. So you can imagine the complex network of finding the right person at the right time becomes essentially impossible. So you can't just pick up your phone and call someone because you don't really know who the provider on call is, and unfortunately, people don't answer their phones all the time. But by having a unique system in place that enables that communication to be efficient and effective, you can really change the way care is delivered in that community.
There's another aspect of this I'd like to hear your thoughts on, Rob. We've just been through over 2 years of a global pandemic, COVID. And during quite a bit of that time, hospitals and hospital staff, everybody from the person who controls traffic in the parking lot through nurses and dietary, everybody and providers absolutely got hammered and went through an experience that probably was once in a lifetime experience in their healthcare careers. And so I know a lot of folks were tired. A lot of folks under all that pressure really had trouble having any job satisfaction. It was really a crisis thing. And so employee retention, all these kind of things. In what way can improving communication help address this issue and at least take the burden of communication challenges off of these folks' back?
Jim, that's another really great question. I'm glad you brought that up. We certainly hope this is a once in a lifetime experience. Yeah. I come from a family of healthcare providers and been exposed to healthcare my whole life. I went on house calls with my grandfather, who was a general practitioner, and so I saw a lot of challenges that healthcare's had for many years, but specifically through this pandemic and through what a lot of people are calling this Great Resignation. I think a lot of people really stepped back and said, I want to do something that I like doing every day and that makes a difference. Again, by providing technology, like many of us have smartphones or other things that enable us to be more efficient and more effective. By providing these solutions, we've designed them back again with that simplicity model in mind. Simple to train people to use. Once they start using technology, they don't want to stop using it. They don't want to go back to faxes and phone calls, for example. So we drive very, very high adoption with our customer base. One of our customers right there in the triangle has reported to us that they have over 96% adoption. That's almost unheard of with various technologies. So that's a big focus of Proficient, and by driving very high adoption, we're driving those standard workflows, and those standard workflows allow people to come to work and they can count on a reliable model to bring information in about their patients, have the information there when they need it. There's nothing more frustrating, as you can imagine, than a patient coming in for a procedure and the caregiver, the patient, or other family members standing there, and the organization says, "We don't have any information about you being here today at 9 o'clock," and they're calling the physician practice and trying to get all that. We eliminate all that chaos, and we've had several customers over the last 10 plus years tell us, by having these solutions in place, my employees are happier. They're coming back to work the next day. I don't have as many people resigning. I have people that are happy with their jobs. And a lot of this was pre-pandemic. But we've also enabled, through the pandemic, we've also grown tremendously by allowing people to work remotely or off-site. So improving people's ability to do their job and do their job effectively, I think truly drives not only adoption of the technology, but some true job satisfaction.
Yeah, I hope the crisis that really fell on especially the inpatient healthcare delivery system. Hopefully we're past that. And again, once in a lifetime, we never thought we'd see anything like that, and we did. For those just coming aboard and listening, this is Jim Tate, and you are listening to the Tate Chronicles. My guest today is Robb Hutchison of Proficient Health. Robb, I've heard you talk about a vision for a connected community. What's holding us back from achieving that today? Is it culture? Is it technology? Is it workflows?
It's two things. If you talk about healthcare delivery and healthcare services, almost everyone we encounter has a personal story of something kind of going wrong, taking their mother to the doctor, taking their brother to receive healthcare services. It's complicated. It's often perceived as being inefficient, although individuals working in healthcare are working as hard as they possibly can and doing everything they can to help people every day. So I think really it's two things. It's what the community is made up of, the healthcare community, its systems, and its people. So we really, to achieve a connected community, we're going to have cooperation from people that are owning and operating systems, and the ability to think about change and embrace change. I think persistence is a big part of this. People being persistent and not giving up on a vision like this. You and the results from those efficiencies. We want to achieve that in healthcare. We're spending, countless dollars every year delivering, world-class healthcare, across the country. And, we need to continue to improve the way systems and people are communicating. So it's really both of those, Jim. It's not just interoperability, but it's truly cooperation between the people and the community, and people being willing to embrace change.
That's true. And having a vision of what a connected community is of data delivery and communication, so we know which way that we're headed. And part of that is we certainly like to assume healthcare is underscored and driven by data, but sometimes a lack of data access or quality or transparency are the very things that are holding us back. Give me an example, maybe of one of your hospital customers who've overcome these limitations with their data.
Well, Jim, we do really truly believe that data is important, and to get good data, you have to really standardize the processes, because if you don't do that, you can't collect a comprehensive source of data. Back to my earlier answer, I think there's clearly a lot of different types of technology available in the wonderful world of healthcare IT. But this vision of a connected community and driving adoption across a community is what allows an organization. We work with the Triad Healthcare Network right here in Greensboro, or in and around Greensboro in multiple counties. And they've done a tremendous job by driving adoption across, literally 200 plus physician practices that are all cooperating, sending and receiving in a standardized way all of their referrals. And that really allows them to collect the data. It allows the users to understand and know who's in network and who's out of network. Driving that efficient, care model into their accountable care organization, or ACO.
Well, Robb, I'm going to ask you to look into your crystal ball and tell me, in your wildest imagination, what does the future hold for connecting provider networks and optimizing the patient care quality? What are some of the hurdles, and where are we in the trajectory of this?
Wow, Jim, that's a complicated question. Somebody asked me recently how far away from achieving this utopian kind of vision we are, and I said, well, I won't be alive when that happens. I have a vision, and I'm working hard on this every day, and I've been, working on this for over 20 years. But I think because we are so fortunate to have such a highly specialized healthcare delivery system, there are just multiple complexities with that type of model that are going to take not only commitment from people and the people that are buying systems, and by buying a new system and implementing a new system such as an EHR, you frequently create increased disparity in how information is kept in that community, and sometimes even inside that organization. So the reason that I bring that up, Jim, is it will take years for people to experience a more efficient model, despite all the effort from companies like Proficient Health that are committed to delivering these types of technology, because people have to embrace them, they have to adopt them, and they really have to continue to work to improve them. So, I wish I had a crystal ball and I could tell you more about it, but I think it's just going to take our team and other teams like Proficient to be dedicated to a vision and a mission that can continue to drive efficiency into healthcare and really improve patient outcomes.
Robb, I think that is a great answer. It really is commitment and vision, and just one day at a time, kind of marching in that direction. Before we totally run out of time today, how can our listeners learn more about Proficient Health?
Thank you for asking. We do leverage social media, but a few real simple things that people can do is come to our website, proficienthealth.com. They can email us, and we'd be happy to communicate to info@proficienthealth.com. We'll also be doing a webinar titled "Use Technology to Improve Access to Care, Drive Growth, and Impact Capacity" on August 4th of this year at 1 p.m. And we'd love people to register They can, again, come to info@proficienthealth.com. We're also on LinkedIn. Happy to see you there, and love for you to follow the company. But we're out here working hard on this every day.
Robb, that webinar you mentioned, I believe August 4th, is it possible to register at the website? Where do you register?
I think if you'll just email us,
okay.
We'll get you registered.
Okay, great.
That's probably the info@proficienthealth.com is the easiest way to register for that.
Okay. To our audience, thanks for joining me on this episode of the Tate Chronicles. I offer a special salute to my guest today, Robb Hutchinson of Proficient Health. Robb, thanks for coming aboard today.
Jim, thank you for all you're doing, and I enjoyed talking with you today.
I did too. You can find more information on this show's program page at healthcarenowradio.com. Until we meet again, here's wishing you smooth sailing and safe harbors.
Tate Chronicles transmission ending now.